Hello, everybody, and welcome to day one of our week-long celebration in the build-up to International AHPs Day on Friday, the 14th of October. I'm Helen Lysett. I'm the Associate Director for Allied Health Professions at West London NHS Trust, and I also chair the North West London AHP Faculty. And in today's session, you're going to see an introduction to the work of the North West London AHP Faculty. So I've had the privilege of chairing that group since it came together in March 2020. You will realise from the date of that first meeting that it formed at the most challenging time the NHS has ever seen as we started to grapple with the COVID-19 pandemic. But through this time, the commitment of the faculty members has meant that we have continued to be able to develop and build a genuine collaboration across North West London, which is now helping us to progress a number of key work streams that will ensure we have a sustainable AHP workforce now and into the years ahead. And you're going to hear a bit more about that later as our faculty project team talk to those work streams. A lot has changed with the faculty since that first meeting in March 2020, not least the fact that we do now have a faculty project team, and those people are joining me on this session today and will introduce themselves. And those people, for those people, it is their job to ensure the programmes of work that we are delivering on have dedicated time and resource and capacity to help drive them forward. So on that note, I'm going to hand over to the project team who will introduce themselves. I really hope you enjoy the session today. I've really enjoyed chairing the faculty. It's been an absolute honour, and I'm really excited about being able to share its work. And now I'm going to hand over to Chelson.
Thank you, Helen. Hi, I'm Chelson Kumar Solomon. I'm the project lead for the North West London AHP faculty. So as a faculty, our key role is to support education, training and supply of AHPs within North West London. So we serve the interests of 14 AHP professions. So it is quite a lot of work streams that we are working on at the moment. And we have a fantastic project team that is helping us deliver on those work streams. Some of the work streams to note are our work on clinical placement expansion and also providing really high quality learning environments. And we're also working on how we could improve response rate and compliance on our National Education and Training Survey, otherwise called NETS. We have very key and important role in collating data and intelligence for the North West London faculty, which could then inform how our workforce strategy is formulated. So we have some important work happening within return to practice of AHPs who want to come back into practicing the AHP professions. So we have some wonderful work that's been started on preceptorship and how we would support people embark on an AHP career early on. That would include being while they're at schools as well, while they're studying in school as well. And we have some more work happening within apprenticeship. We are trying to find out, look around what is happening within our providers within North West London and see if others could benefit from some good work happening within individual providers. There is more work happening to support our workforce within North West London as well. And as always, we do have in our agenda to support equality, diversity and inclusion. Thank you. So I would now pass on to Rina, who is our relationship manager within the AHP faculty, who will talk a little bit more about her work within the faculty.
Hi, thanks, Chelson. So yeah, I'm Rina Shah. I'm the relationship manager for the faculty project team. And as relationship manager, one of my responsibilities is supporting the partnerships between the Trust in North West London, our partners in Health Education England and the HEIs or universities that we work with. So at the moment, I'm currently scoping out who's who to create a directory to make it easier for partners to know who to contact for what. And all my work streams at the moment are around things related to student placements. So at the moment, this involves supporting trusts to access the non-medical education tariff that's received for AHP placements and looking at how that can be used to benefit students on placements. Also supporting trust with their clinical placement expansion work, and supporting the increased uptake of NETS, which is the National Education and Training Survey. One of my colleagues, as you can see on the screen, Toria Kilsby, she can't be here today, so I'll tell you a little bit about her work. She is the lead for the faculty support workforce work stream, and that work stream is all about establishing a North West London community of practice of AHP support workforce ambassadors, working together with the North West London AHP support workforce to develop offers for learning and development and career progression, sharing all their resources and innovations, and implementing the Health Education England AHP support worker framework. So I think that's given a little bit of a taster for what some of us are doing. I'll now hand over to Sandra.
Thank you, Rena. Hi, I'm Sandra Lennon and I'm the AHP Workforce Data Project Lead for the faculty. So my role involves deep diving into various data sets such as current positions, vacancy rates, ethnicity, age, etc. And this is to help us to build a picture of the AHP workforce so that we can consider supply and demand for supporting our recruitment needs, as well as getting an understanding of what's working well and areas that we may want to start to develop and improve. And that's both at a faculty and also I can do that at a trust level. The data I pull also feeds into the various workforce supply projects that are ongoing at the moment, such as apprenticeships, return to practice, support worker development. And this gives us also a picture of the respective workforce, and then also feeds into assisting with implementation and development of the projects. So I hope this gives you a little understanding of my role and what I do within the faculty, and I wish you all a very happy AHP Day, and I'll hand you over to Hannah.
Thank you, Sandra. My name is Hannah Howelday and I'm the AHP Preceptorship Lead for the faculty. So some people might not have ever heard of preceptorship. So I think it's important that we understand that to understand what I do. So preceptorship is defined by the Department of Health as a period of structured transition for newly qualified practitioners, during which they will be supported by a preceptor to develop their confidence as an autonomous professional, refine their skills, values and behaviours, and continue on their journey of lifelong learning. And by March 2023, the HCPC are due to be releasing evidence-based principles of preceptorship that all AHP professions will be expected to engage in. We know the benefits of preceptorship are well researched and evidence-based. We know that having a preceptorship programme increases job satisfaction, enhances NQP's confidence, improves retention of staff, and makes staff feel valued and gives them career aspirations. So it's my role within the faculty to lead and coordinate a preceptorship offer within North West London. I will be supporting all organisations in North West London to develop and implement an AHP preceptorship programme for all AHP staff, and trying to work with the organisations to ensure that everyone is taking a consistent approach wherever possible. And finally, I'll be working with organisations in North West London to hopefully increase the uptake of AHPs accessing a preceptorship programme. We would love as many people as possible to understand the value of preceptorship and get involved. We look forward to working with you, and I will hand you over to Claire to finish.
Thank you, Hannah, and hello everyone. And my name is Claire Forden. I'm the North West London AHP Workforce Transformation Lead, and I work with the North West London AHP Council. And in that role, I'm working alongside the faculty project team and all partners across the North West London integrated care system to develop a strategic AHP workforce plan for North West London. And the intention of this plan is that over time, we will continue to build the supply and development of our AHP workforce and implement approaches to do that. So from all of us here, we wish you all a very happy AHPs Day.